Today we're going to ultrasound the shoulder. Ultrasound is a more inexpensive way to look inside the shoulder and see tendons and ligaments. Often your surgeon will order an MRI, but an ultrasound can be done in clinic on the spot and is far cheaper for those with high deductible plans. And a lot of the literature shows it's just as sensitive and just as good as MRI if done in the correct hands. We're going to start with the biceps tendon. The biceps tendon starts at the biceps muscle, which is formed of two muscle heads. One tendon crosses up and over the rotator cuff. The ultrasound technician or the doctor will place the probe in the front of the shoulder, and the patient will hold their hand such as this. And then what we'll do is go in a transverse image and look down and see the tendon. Now gently externally rotate your shoulder. Good. And what I'm looking for is seeing if the tendon stays in its groove, go back, internally rotate, and stays under the ligaments and structures that hold it in. And I also look at the bone itself, and then I'm also looking at a muscle called the subscapularis, which starts over here and inserts on the shoulder and is an internal rotator of the shoulder. His muscle looks good, it's attached correctly, there's no evidence of tearing or fluid. The biceps tendon's in a great position, everything looks awesome here. Now, another way to look at it is longitudinal, and I can look at how the tendon actually inserts on the bone. So you'll look in different planes to diagnose different problems or to prove that there are no problems. Now to look at the rotator cuff, the one of four tendons that's commonly torn, the patient will sit like this. That brings the rotator cuff forward and in the field of the ultrasound. This is the supraspinatus tendon. And I can look at the anterior part. Most commonly, the supraspinatus has a partial tear at the anterior insertion on the humeral head, and it's usually an undersurface tear. Often these will heal on their own and you don't need any intervention. If you do need intervention, most will heal with therapy. If they are repaired, up to 40 to 50% re-tear within a year, so I often don't recommend surgery for these. Anyway, I take my ultrasound probe and I roll over the tendon itself, and I can visualize nearly the entire tendon in this manner. Another thing I can do, if we had a tear, this young man does not have a tear, what I would do is ask him to push his elbow out against me, and I could actually watch the muscle retract and pull the tendon tear off the bone. Obviously that's not occurring here. The next thing that we'll do is look under his acromion. You'll often hear of people that have decompressions. That's when you go in and actually shave the undersurface of the acromion bone. And I'm going to look up here. I'm going to see the acromion bone, I'm going to see a bursa or a fluid sac underneath, and then I'll see the rotator cuff as it inserts on the arm again. And I can again go anterior, posterior along the whole area and see the insertion and look for any tearing, fluid, altered signal. Often what I'll do is look here, find the subdeltoid bursa, which is a fluid sac underneath the large deltoid muscle or shoulder muscle, and I can actually perform a guided injection in just the right spot, right next to the supraspinatus tendon itself. That's a far more accurate way to inject than is typically done. Next, I'll look at the back of the shoulder, and you can actually look at, you can relax, you can actually even see the glenoid, which is the socket part of the ball and socket joint. You can look at the glenoid and its labrum. The labrum you'll hear about, labral tears, slap tears, things like this. The labrum is really just a cushion that exists in the socket part of the shoulder that allows the shoulder to move around in the large range of motion that we normally have, and it acts as a bumper. So often pitchers will have labral tears, and swimmers, such as the butterfly stroke, will have labral tears. Sometimes these need to be treated surgically, more often they don't. And lastly, you can do sort of a dynamic study again and have the shoulder move around while you're looking at it in a posterior fashion. That's just a basic, quick little introduction to ultrasound of the shoulder. You can do a far more detailed exam, and certainly we can do more dynamic studies, but this just gives you a basic idea of things that can be done nowadays in the clinic setting for just your copay. For more information, please go to www.warnerorthopedics.com or call us at 225-754-8888. Thank you.